High blood pressure is considered the silent killer, and it affects over 65 million adults. My name is Kayla Windsor, and today I'm going to demonstrate how to take a manual blood pressure. Being able to take a blood pressure properly and determine if it's within normal parameters is very important, especially when working in the healthcare field. It is also important for individuals to be able to stay in tune with their health and be able to evaluate if they do need to seek further medical care. And that can all be done in your home by taking your blood pressure. When taking a blood pressure, you're going to be listening for two things. We have the systolic pressure, and this is the pressure of the blood up against the heart. And this is going to be a tapping noise that you hear in the stethoscope. And then once that tapping noise disappears, we will have what is called the diastolic pressure. The diastolic pressure is a relaxation of the heart. Again, these are very important. These can give a lot of insight into an individual's health and can be an easy fix if you seek the medical attention you need in time. So first, what you want to do is you want to gather your materials. We have a blood pressure cuff, also called a sphygmomanometer, and we also have our stethoscope. And that is all we need. Once we have gathered our materials, we want to make sure our patient is in the correct position, sitting upright, legs uncrossed, feet flat on the floor, and we want to make sure they've been sitting for probably about 5 minutes. And it is also important to check and see if they've had any caffeine or nicotine within the past 30 minutes, because this can give us an inaccurate reading. Once our patient is ready to go, we're going to take our blood pressure cuff. We want to make sure our blood pressure cuff is the right size, because if it's too big or too small, it can give us an inaccurate reading. We are going to take it, we're going to place it on the upper part of the arm above the brachial artery. We'll just wrap it around. We don't want to do it too tight, but we want to make sure it's on there snug. And then we're going to take the bell of our stethoscope and we're going to place it above the brachial artery, or directly on it. Once we've gotten our placement correct, we'll begin to inflate the cuff. You want to make sure it's pretty tight, and then we will slowly release it, letting it fall just a couple dots at a time. (132/98). 132 is the systolic pressure. Again, this is the pressure of the blood up against the artery. And the 98 is the diastolic, and that is the relaxation of the heart. It is very important, again, to be able to take a blood pressure and do it properly and determine when it is in with normal parameters. We usually want it to be 120/80. A little bit above is something you want to reevaluate, but not be too concerned until it starts getting 150/100 and so on and so forth. So again, when taking a blood pressure, we just need our stethoscope and our sphygmomanometer. We want to make sure our patient is sitting in the correct position, have been resting, and once we do that, we just place the cuff and then the bell of the stethoscope over the brachial artery and inflate. Once we've inflated the cuff, then we'll just slowly release the air. And then we will listen for the tapping noise, our systolic pressure, and the disappearance of that tapping noise, the diastolic pressure. Thank you.